but I guess you're recording this, so you can deal with that. I wrote down a few things that I think are really, really key, especially in writing grants targeting Native populations. The first one is making your case for your population through transparent use of data. And this is really tricky, as all of you know, when your population numbers are small. And it's really important to acknowledge that your numbers are small rather than providing what I would call sort of fuzzy math, which is looking at rates and disparities and that sort of thing. If the numbers are so tiny that the person reviewing the grant is going to just pick it apart because the numbers are too small. And reviewers do look at that. It's also, I think, really important to talk about the limitations of the data, including misclassification, particularly when you're dealing with the kinds of stigmatized health conditions you all are working on. So we find that the classification of reported AIDS cases, for example, is probably not 100% accurate. And then of all populations, Native populations are probably misclassified the most. So I think it's really important to talk about that in the context of our population numbers look small. Secondly is using evidence-based interventions. And this is something that's becoming more and more and more important in public health, almost to a fault, I think, where your own experience is looked at sort of less favorably than using an evidence-based intervention. So my suggestion is always to make sure that your intervention that you're proposing is either modeled directly on something that's proven effective. If you can't do that, to model it on what would be considered best practices. And if you can't do that, at least to talk about how your intervention is based on some sort of a theory. And there are a lot of health theories, health-related theories, such as the health belief model, theory of reasoned action, other theories that basically explain and predict behavior. And I think that grant reviewers will often look at that as favorably as they would a program that's directly based on something that's evidence-based. The next thing I think is demonstrated experience directly with the population. That's really critical, especially when working with populations that are hard to reach. And sometimes I think in agencies we just take it for granted that people know that we know how to work with these populations because of the name of our agency. But pretending that the reviewer doesn't know anything about your agency is a good rule of thumb. Another thing that we look for is passion. And that's kind of a funny thing because you want to write in a very clear, objective way, but I think somehow your passion for the population you're working with and the type of intervention you're doing needs to come through. And it can help to have someone else read your proposal and sort of look for that, and you can tell them, look to see if there's some feeling that comes through here, especially when reviewers are reading dozens of proposals. It's really useful to make yours stand out that way. We're going to talk later about partnerships, but partnerships are becoming more and more important, but only where they're really relevant. It is not helpful to just have a laundry list of partners or 25 letters of support or something like that, because again, reviewers tend to see that as being just a ploy to demonstrate that you're involved with the other agencies and whatnot. Clear, transparent budget that isn't padded with personnel expenses is really critical. A simple thing that it's amazing how I would say that 80% of the proposals I review have either math or grammatical errors or haven't followed the instructions on how to use the forms. And those are the kinds of things that can sort of make or break you if you're competing against someone else. And then finally, my last little tip is if you do use a grant writer, make sure they really understand what you're trying to do. When you read a lot of proposals, you can tell what's been written by a grant writer and what's been written by a person that actually works with the population. So make sure that your proposal doesn't sound canned, that basically a grant writer took it and just inserted the name of your agency and a few statistics to make it sound like it's actually an original proposal. So those would be I think my key tips.
Thank you, Karen. Do any of our other panelists have anything to add on this subject? Then we are going to move on to question 2. What resources are necessary to write a successful grant proposal from an agency perspective? And our first speaker on this is going to be Mark Espinoza. Hello, Mark. Oh. Sorry.
Hello?
Oh, hello. Sorry. We couldn't hear you there for a minute. So question 2, we're now, Mark is
Yes.
our second speaker.
Okay, for strategies, I would say one of the things that we try to do is we try to incorporate things into a grant that distinguishes us from other organizations or other entities. One of the things we did when we wrote our a CDC grant, which was a demonstration project, was we focused on activities that we would do in-house, such as beading classes, talking circles, traditional consultants, and those set us apart from other organizations in terms of prevention activities. The way we spin that was, we said, in order to keep these people off of the street or from engaging in dangerous behavior or unhealthy behaviors, we're bringing them in-house. So obviously you have to show that you have the capacity to have meetings and to bring these people in, and then how you're going to engage them, and then when they're engaged, how you're going to promote prevention messages to them and target prevention messages to them. And you learn through the talking circles what messages need to be reinforced and what messages you can put out there. All of that you put into your grant proposal. I want to piggyback off of what Karen said when she said make sure you know that the grant writer is familiar with what you're trying to do. I think that's very important, because if you don't, your proposal is going to be all over the place. You need to have someone that understands the services that you're willing to provide, and to some extent understand the population that you're going to serve. You also need to understand what the grantor is looking for, so you need to do a little research on them. What have they funded before? What kind of activities are they looking for? And again, I think your uniqueness is one of your most valuable assets.
Thank you, Mark. And again, if any of our other panelists have anything to add on the topic, please feel free to jump in at any time. Our next question number 3, is what makes for a successful partnership between a funding agency and a grantee? And our first speaker is going to be Lisa Neal.
I'm a little self-conscious because some of my grantees are on this call. But in my talking points about this, I think the most important thing is actually relationships and communication. And really, especially grantees that are having a struggle or they're having trouble getting off the ground, there's a tendency, and it's a natural human tendency, to sort of, not hide that, but not highlight that for the agency. And, funding agencies, especially if it's a cooperative agreement, they're really set up in order to help grantees to succeed, and that's what they want, is for grantees to succeed. So it's very important to take advantage of those resources, even if it's just somebody who can troubleshoot or develop ideas or sometimes come up with insights. So a lot of times the funding agency representatives that you interact with, they might oversee dozens of grants at a time, or dozens of grants or hundreds of grants throughout their career. And so there's a significant chance they've run into some of the problems you're having in the past, and will have ideas on how to address them. And that's a really important thing, because I think a lot of grantees, especially if they're new or small, there's a tendency to want to look like they're doing perfectly until that last possible moment, and they're a month before closeout, and they've only spent 10% of their funding or something. So it's very important, I think, to communicate and communicate effectively with your funding agency, and also get to know the relationships internal to the agency. The vast majority of federal funding is actually managed by 2 or 3 different people. So there'll be somebody who's more in charge of the specific grants process, things like your budget, getting expenditures approved, things like that. And then there'll be someone else who is more organized around the content that you're working on. And so it's important also to just include both of those people or both of those sides of the shop as you communicate, because oftentimes changes in approach or changes that are proposed for your activities will also have impacts in other aspects of the grant. And it's just very important to be sure that everybody who should be engaged in those decisions and conversations.
Thank you very much, Lisa. Moving on to our next question is, what are effective strategies for attracting funds for urban American Indians, Alaska Natives? And again, our first speaker is going to be Mark Espinoza.
Again, I think stressing your uniqueness, one of the things I have to point out too is that we have community partners. We have the Native American AIDS Project, which is a small organization but a very vocal organization, and they're known by those at City Hall. In terms of city and county funding, we partner with them to provide services to our patients because they're distinctly a Native organization, and we are not so much because we're an FQHC clinic. We can have them focus on the purely Native aspect, and we come in and say these are the services we'll provide. They're going to provide the referrals to us, and we're going to partner on certain events. And I think that has allowed us to be successful on a citywide level. Of course, there's also clients who can advocate. San Francisco is a little different beast from most places because it's very political. The squeaky wheel gets oiled. You know, if you go out and you might have 10 people protesting in front of City Hall, you're going to get attention because the media likes that. So in some ways, being a small community it's not been detrimental. In terms of funding, it has been because you get a smaller percentage. But it also, if you get 5 or 6 people with the same message going out to City Hall and talking to people who make funding decisions, usually you're going to get something out of that. You know, it goes back to the old days where people were out protesting, marching, and doing all of that. There's a targeted way of doing it, and what we'd like to do is focus on, again, our uniqueness, Native people, the resources that we don't have, the resources that we need, and basically at times calling them out on on what we need. And it's been successful to a certain extent, but also reiterating, you do need the data. You need that information to back up why you need these services and how you're going to provide them and what success you've had in the past. I think that's really important. We're Title I Center of Excellence grantee, and the reason the city does fund this is because we're a successful program and we show them year after year with our ARIES data and with the data that we provide to them that we're providing the services in a comprehensive manner. And basically, we're not wasting their money or their time. We're doing what we say we're doing, and we're always going over our deliverables. I think that's important. You want to meet your deliverables and exceed them to show in the future when there's extra money, hey, why don't you throw a few dollars to us? Look how much we've done over and above our contract. So I think that's important.
I was just going to add one thing to that, and that is I think an effective strategy can be making sure that you're applying for what the funder wants to fund, but also working in the things that you would like to see happen. So, for example, in HIV right now, clearly the emphasis is on case finding and linkage to care. But if you think that part of what needs to be done is general education about HIV and testing, you could work that in by including a component of your application which is around test promotion, which could be very broad and include some of the other things you want to do, which could be focus groups or discussion groups or media or something like that. But I think really making sure that you focus on the current most effective strategies is probably your best way to get funds in. And also, I think talking to the funder. If you're not sure what they're looking for, then call them on it. If you get a vague RFP, then call them and say, what is it you're really looking for?
Excellent, thank you. And our next question, question 5, is how can we present urban American Indians and Alaska Natives as a priority to funders? And speaking to this question will be Elizabeth Nasser from UIHI.
Hi, everyone. I think Karen's point was really great, which is generally we're looking at STD data and HIV data. The numbers are really small, and so it's important both to be transparent about that and also to make the case and try to best share with funders what you think is going on in your community and what the major issues are, and that can just be really challenging with data among American Indians, Alaska Natives. But there's a couple of options and things that we work with sites on if they're working on a grant or just trying to understand what's going on in their community. We recently requested and received some STD surveillance data from CDC, and so that has rates of gonorrhea, chlamydia, and primary secondary syphilis as recent as 2009. And it's only available because our UIHO areas are counties. We can't actually release that data, but we can share a national aggregate number for all the urban areas that the UIHO serve. Another option, just thinking about national surveillance data, the National Survey of Family Growth, we have that data in-house as well, which has questions about sexual history and behavior and some risk factors for STDs. That we have 1 year only for 2002. There's also BRFIS data available that we have in-house, and that has some questions about HIV testing that you could get both national UIHO aggregate as well as UIHO areas. And we really work with people to try to share a number of different types of numbers to make the case. So maybe you don't have the county level data for 1 year in the area that you serve, but through a combination of numbers you can paint a picture of what's going on by sharing the sort of national urban American Indian Alaska Native rates. You can also look not just in last year, but we often look at 5-year numbers together to try to get that estimate, those rates a bit more stable. So there's some options there. Another option is to request data yourself from CDC, from IHS, from local and state health departments. So again, you could have sort of a picture of what's going on in your state to get that local picture, thinking about perhaps chlamydia rates might be higher in your state, and when we look at national numbers, we miss that. So sort of combining that with what's going on in the UIHO aggregate numbers might help you paint a picture of the need in that community. Looking also to your own clinical data might be an option. And we also, at UIHI, help people look for epidemiological studies. So maybe those surveillance numbers aren't there, but maybe there's some studies that have looked at communities that are similar to yours or even in that area that might have some interesting findings that you can share with funders. I know we mentioned partnerships earlier, but some sites we worked with have partnerships with local universities on primary data collection or things like focus groups, again, to get some of that more qualitative information. So that's an option too. I think it's really important, as Karen said, to be very transparent about what we have and what the limitations are, and then to do our best with the data we have to try to make the case for the need.
Thank you, Elizabeth. And then our last question that we have, and I would invite all of our guest speakers to speak to this issue, is what are possible funding sources that are available for HIV, AIDS, hepatitis, and STI prevention work? Some of the sources that you work with. Mark, would you be able to talk a little bit about some of the your grant funding sources?
Sure. Is Nazba on the phone call?
Yes. Can you hear me?
Yes. I'll just start out. I'll let Nazba fill in some of the gaps, but I'll tell you that as far as San Francisco City and County, prevention funding has significantly been dropped and or totally eliminated just due to budget cuts. So we're finding it very hard to find prevention monies to provide those. What we have done is we've collaborated with our mental health department to write grants that focus on some prevention activities such as HIV testing at powwows and community events. Nazba, can you add to that?
Yes, we actually just recently got funded by SAMHSA. It's a CSAP grant for HIV and substance abuse prevention. It's a 5-year grant. We, as a part of that grant, are expanding HIV testing to 75 more people beyond the sort of our normal testing coming out of the IHS testing grant that we have. Additionally, we're going to implement 2 different curriculums, Safety Counts and Community Promise, to sort of target HIV and substance abuse prevention on sort of a bigger scale using media, print and video media, as well as a combination of individual counseling, HIV, substance abuse prevention counseling, education, referrals to traditional consultants, community groups and events. And then we're also doing a yearly GONA, gathering of Native Americans, for the Two-Spirit population, preferably around Pride Month, just to offer a safe and sober space to celebrate Pride events. And then, you know, ongoing linkages and referrals to a lot of our partner agencies within our own clinic here, as well as within the city and across the Bay Area. And this funding actually complements a lot of the ongoing treatment and other services happening within the Circle of Healing, but also within Family and Child Guidance Clinic. And we're looking into universal testing within our site, as well as piloting integrated behavioral health services. So we're hoping to engage the other departments around HIV and substance abuse prevention, and hopefully that helps in the long run people engage in services and adhere to their treatment, whether it's dental, medical, mental health, HIV, so that they, you know, can come here and get many of the services that they're requesting and that they need, and hopefully they can benefit from it. Hopefully that helps.
It does. And one of our respondents has mentioned state health departments as a possible sources of funding. Lisa or Karen, would you be able to jump on this question?
Well, I can jump in a little bit. I think in Seattle, King County, there actually are very few funding sources available for at least HIV and STI prevention work. I'm not sure about hepatitis. It's not really my area, but I think when there is not designated funding, it's important to get creative about partnerships and who you're working with. So, for example, if there's a large HIV prevention community-based organization that you know primarily is serving white gay men, and you know that there is HIV among Native American men who have sex with men, to go to them and really hold their feet to the fire and say, I would like to be written into your grant. Because when the funding is carved up the way it is now, which is really targeting the populations with the greatest disease impact, it's really hard often to find sources for small populations. But I think it's also really hard for larger agencies serving majority populations to say, no, we're not going to do that. So I think effective use of partnering is probably one way to get around that problem.
Excellent. And I guess to open this question to anyone on this call, if to share with the group other sources of funding that you know are available or that you currently get for your HIV, AIDS, hepatitis, or STI work. But I think we've gotten quite a few good suggestions and good ideas from our partners. I know that we at the Institute, National Institutes of Health, Office on Minority Affairs, SAMHSA, all have, opportunities and to really pay attention we at the Urban Indian Health Institute, we have a weekly resource email that we send out every Monday of the week. And you can sign up by going to our website, www.uihi.org. And we include opportunities not necessarily just for HIV, hepatitis, or STI work. It's for all of our work that we do, and that's our main communication strategy. But we do pass along grant opportunities that we think are relevant to urban Indian health organizations. And some of our callers in on the call, they've mentioned Vertex and Merck are currently both funding hepatitis C efforts. And MAC is also funding this work. And then another caller has mentioned that sometimes you can partner with academic and research organizations, maybe in your community. But I would like to thank all of our guest speakers and our participants for adding to this conversation today. So now I would like to open up the floor to any discussion or questions that anybody might have. Another caller had mentioned that you could check with your state viral hepatitis coordinator, and they may know of funding opportunities for your organization as well. And thank you for everybody for your comments. Does anybody have any questions they would like either to type in to the chat function or to please speak up and just talk online if you want to? And I would like to invite our panelists if they would like to give any final comments or closing, if you would like. Okay. Well, I would like to thank everybody for being on the call today. If you have any questions about this webinar or you would like to talk more about this subject, please give me a call or email me. Here's my contact information. We will be sending you a link to a follow-up survey about this webinar that we do for our own program, improvement. You will be directed to a link after this WebEx to a survey for our quality improvement. But we'd like to thank you for being on this call. And for our guest panelists, I would like to thank you very deeply for your time and expertise that you've given us today, and hopefully have given our callers some ideas about how to fund this needed work. I'd like to invite if you'd like to say goodbye or any final questions.
No, thanks everyone for coming. We appreciate you being here, and stay tuned for information about our next webinar. We'll be sending that out in the WRE.
Right. And if any of your colleagues are interested in viewing the webinar and they weren't able to make it on the call today, we just wanted to remind you that we will be archiving this and having it available on our website.
And if you would like to get the website information, we'll send it out to you, or again, you can contact me, or if you'd like to have me add you onto our weekly resource email, you can also send me your information. I'll add you onto that. But thank you everybody for being on the call, and we hope to hear from you soon. Thank you.
Bye.
Thank you.